If you've had an L4-L5 or L5-S1 disc herniation, that's the most common area of the spine to wind up having a herniation. And the most common treatment for that winds up being a spine fusion surgery. And they're only successful less than 50% of the time. Yet every year, over 400,000 of these are done over conservative therapies that can wind up resolving these problems entirely. If you've been suffering from problems with this video is going to be for you. We're going to go over our 3-step process to wind up reducing inflammation, restoring disc height, and getting you back to the life you remembered without going anywhere near the operating room and getting you back to what you want to do. So the L4-L5 disc area is in your lower back, right down here. This is an area that winds up absorbing a lot of the pressure of your body, provides a tremendous amount of motion, and then also has a lot of architectural stability to keep you as upright as you can. When problems break down here, it'll typically show up as pain in your lower back, but not always, because it can often wind up affecting the nerves that come out of your lower back, go down your legs and to your feet. If you have either of these, that L4-L5, L5-S1 disc may be herniated or injured. And either way, the 3-step process that we've developed can wind up helping to reducing the pain, restoring the right motion, rejuvenating the discs, and most importantly, getting you back to the life that you thought you should remember. So whether it's that you were able to pick up your kids with ease, or grandkids, or you were able to play a round of golf without any problems, or go for a walk as long as you'd like without thinking about your lower back, these are ways that an L4-L5, L5-S1 disc can interrupt life. Now, the model that we've developed to help restoring this disc involves 3 steps that include spinal decompression, specific spinal adjustments, as well as tissue rejuvenative therapy utilizing soft wave TRT to help rejuvenate tissues. Now, I'm going to go over each of those steps so we can guide you on how to get back to life and how to stay away from the operating room. So what I want to go over with you now is the first piece of our 3-step spinal rejuvenation system. And what this first step involves is spinal decompression. Now, when you have an L4-L5, L5-S1 disc, the vertebrae, which look just like this, wind up having some compression. And instead of looking like this, once you've had that L4-L5 disc degeneration, it'll look more like my friend over here. You might notice that there's not as much space right here. That's where the disc is. You can even start to develop some osteoarthritis. And then to me, the most significant piece is that you notice how different these nerves are. This one over here is healthy, big, and plump, whereas this one is thinned out and compressed. Now, when it's compressed like this will cause you to have difficulty with pain and symptoms going down your leg that can really be debilitating. Our first steps on cases like this is to work on taking pressure off of that spine in those regions. Now, we use a unique seated decompression to allow to do that, because in most things you do, that's the position that you're in. And for people who have severe disc irritations, they're more likely to be able to get to a seated position than any others. It's really gentle, and it's safe, and it's guided with you and one of our team members to help decompress that disc. Now, there's 2 main factors that happen here. The first one is that as we elevate and spread out, open up the disc space, the nerve over here has less pressure on it too. So it helps to alleviate the pain and symptoms going down your legs. The second thing, which is super cool to me, is that we allow the disc to get nutrients the way that it should. Now, the way that discs wind up getting nutrients is through something called imbibition. Why don't you guys go ahead and say that with me? That's a fun one. Imbibition. And what that means is that it absorbs nutrients from the bones above and the bones below, but has no blood supply. When it has pressure on it irregularly, as a worn out disc can do at L4, L5, and L5-S1, imbibition slows down and can be eliminated entirely. And that's why the disc degenerates. So taking the pressure off of the disc allows for nutrients that it needs to get into the disc and toxins to get out and removed, so you're in less pain. That's some of the reasons why we use decompression as one of the first steps in our rejuvenative system to get the discs to get healthy again and for you to get back to the life that you want. In our next segment, we're going to go over how specific spinal adjustments help in this process. Okay, so we're moving into the second step in our disc rejuvenation system. We've gone over how we use decompression to open up the discs and help re-imbibe the discs with nutrients. What we're going to go over now is some specific gentle adjustments that we do to restore proper motion and architecture to the joint. Now, the joints in your lumbar spine, especially at the bottom, are designed to have a big curve in them. That allows for shock absorption. It also allows for great mobility and for strength. However, as you have injuries to your lower back, you can wind up losing that. That's why it's super important for you to work with a corrective chiropractor to assess that and to understand if we need to work on remodeling your spine when you've had lower back injuries or problems. One of the types of adjustments that we use for our patients who have L4-L5, L5-S1 disc injuries winds up being some gentle pumping mechanisms as well as using tools to help with changing that and adjusting the spine. So the adjustment that we'll typically wind up doing is on a table just like this, where we'll gently elevate the hips and the pelvis to wind up helping give that position they should be in, that big lumbar curve that you should have. And we wind up utilizing just some gentle pressure to allow for those discs to get more nutrients and to help almost similarly to how we do the decompression, but on an individual segmental level. We look for feedback from our patients on how they're responding to this to help create mobility and to allow those discs to have pressure released. In addition, we may wind up using one of our tools like the ArthroStim. That's what this tool is right here. It's super gentle and allows for us to wind up providing specific adjustments to the individual segments that may be irritated and to avoid segments that we don't need to adjust. This helps for that lower back to start to get the mobility that it winds up needing so that it can wind up moving right. So that second step in this process is specific adjustments and pumping of the vertebrae to allow for proper mobility and to start restoring the proper curves to your spine. The next step, we'll go over the tissue rejuvenative therapy that can spark healing and get you back to where you want to be. Okay, so if you've been having an L4-L5, L5-S1 disc herniation or injury at all, we've gone through 2 of the 3 steps of our lumbar disc rejuvenation system. The first one was that spinal decompression. The second one was the adjustments to introduce individual motion. And then now I'm going to go over with you our tissue rejuvenative system, soft wave therapy, TRT. This is something that winds up pulling in tissues to help regrow the right ones. And it's kind of an accelerant and a catalyst to really help those discs imbibe quick. With this, it's really amazing in that it recruits stem cells to the area so that the tissue can regrow the way that it should. So if we worked on decompression, the nerves, and the disc to allow the nutrients to get in, and we've started to introduce the right motion with adjustments, this winds up helping to recruit the right cells to grow into the tissues that we need. The great thing about this is that we know with this device, if you're a candidate for it, on our first visit. So in most cases, when you're looking at stem cell technology, you've got to invest a ton up front. You don't know if it's going to work and you just pray. However, with our soft wave TRT, we're going to know on our first visit if you're a candidate for it and if it's going to help you. And if it's not, we're not going to recommend it as a part of the rejuvenative system. This piece is really super powerful. It's been able to help us show great change very, very fast. And if you've had disc injuries, you've got to try it. So you've got an L4, L5, L5-S1 disc herniation, and you're not sure what to do. You've been told that you may need surgery or you may need epidurals, but you don't want to go through those because they may not help or haven't helped in the past. Our 3-step lumbar spine disc rejuvenation system has been helpful for so many people that you've got to give it a try. If you've seen these videos and thought, wow, that's an interesting concept, or I've even used pieces of this, but nobody's ever put it together, That's where we've been able to help people to take leaps and bounds beyond where individual pieces of the puzzles wind up working. If you're wondering if this system winds up being something that can help you, feel free to reach out to our team. If you're not in our area and you want help, go ahead and write down below and we'll look to find some place that can wind up helping you. If you found this video helpful and informative, please go ahead and subscribe to our channel. Or if you know someone who's going through an L4-L5 disc herniation, make sure to pass this along to someone. Unfortunately, there are way too many lumbar disc surgeries and fusions that happen, and so many of them are unsuccessful, over 50% of them. Let's look to see if we can help people get through a process that's non-surgical, that's non-permanent, that can help them get back to the life they want and the life they know they could have without those drugs or surgery. Once again, I'm Dr. Greg Gerston, and I'll look forward to seeing you in our next video.